My name is Osama Rahma. I am a medical oncologist at Dana-Farber Cancer Institute. I'm also an assistant professor at Harvard Medical School. My role at Dana-Farber is in cancer immunotherapy drug development. And in our program, we move cancer discovery from the lab to patients. The cancer immunotherapy field had evolved tremendously in the past decade. When we started years ago, when I was in training at the National Cancer Institute, we were trying to evoke an immune response against cancer by using cancer vaccines. We were able to see immune responses. However, this did not translate to a meaningful clinical benefit. The breakthrough in cancer immunotherapy came when the immune checkpoints were discovered. And the drugs that inhibit immune checkpoints, that are called immune checkpoint inhibitors, became truly the breakthrough of the century in cancer therapy. Today, many of cancer patients respond to these therapies, and many of them are cured because of that. However, still some patients would lose this response, and many patients don't develop response to begin with. There are many tumors that are very resistant to these type of therapies, including pancreatic cancer, ovarian cancer, and breast cancer, and others. We truly need to understand which patients respond and which patients don't respond or develop resistance, so we can develop a personalized medicine for cancer patients. This is the focus of our research here at the Farber, and we are trying to understand the biology of different cancers and each patient and why some patients would develop resistance or not. We're trying to understand the biology of certain tumors and why certain tumors don't respond, whether there is certain receptors or certain genomics profiling of these tumors that makes them resistant to immunotherapy. An important example is the recent FDA approval of one of the immune checkpoint inhibitors in cancer. And that's not just based on it's not just based on the cancer itself, what type of cancer, but rather based on a biomarker. The biomarker is the microsatellite instability of the tumor. And another FDA approval that came recently is for tumors that have high mutational load. Those tumors are very, very active, and the immune system is pretty much alarmed and is ready to go. It just requires to remove the immune blockade on it, and that's what immune checkpoint inhibitors do. Today, we're trying to understand why patients respond or don't respond to immunotherapy. We're also trying to understand why patients develop side effects or don't develop side effects to immunotherapy. Our goal is to make these drugs work for every patient and to continue to work for these patients. Our goal also is to try to minimize the side effects for patients and try to understand why they develop in some patients and don't develop in others. Our program will continue to be committed to help cancer patients, and we'll look for the future for every cancer patient to respond to these therapies and, again, to minimize side effects. Thank you very much.